Welcome, everyone. We are going to be discussing the book Saving Ourselves from Suicide Before and After. Tonight's book discussion will be facilitated by our health science librarian, Claudia Pete. We have special guest Rachel Vusic, who I've never confirmed if I'm pronouncing your last name correctly.
Close. Vusic.
Vusic. Oh,
Yeah.
that wasn't too far off. So, but thank you.
You're fine.
Rachel is the director of behavioral health, intensive behavioral health services at WellSpan Philhaven. And we may have a couple of other clinicians pop on, Trond Harmon, pediatric clinician from, I almost said Philhaven, Keystone, and then Katrina Lunsford, who is a communication support, community support program facilitator, certified peer specialist for Mental Health Association of Franklin Fulton County. So if they hop on, okay, thank you. If they hop on, I'll make sure to point that out. But in the meantime, Claudia, I'll turn the floor over to you to start the discussion.
Okay, and let me quickly check because I have an email, I think, from Trond. He said, is there a different link for tonight's meeting? So
I will take care of that.
Okay, thank you. So he will be joining us. Let me just let him know. That's what happens, right? Okay, so we can go ahead and get started. I like to always start with reading a portion of the book. And last time I read just a little bit about Nick. And this time I thought I would start on page 6, where it says, we all have times when we feel a little down or experience the blues. But if ongoing symptoms rise to the level of impairing our daily functioning, then it may be more severe than a temporary glum mood and may very well be a mental illness. It can be challenging to understand what is happening inside a person who has a mental disorder. No matter how hard I try, I cannot imagine the pain my son was experiencing or know how his brain was affected. Could he concentrate? Were his thoughts jumbled? Did he hear voices? Was he always anxious? Did he have some idea that his mind was slipping? And those who do not suffer from anxiety, depression, or any other mental illness need to try their best to be non-judgmental, open-minded, and empathetic towards people who do. None of us can read a book or get a degree and believe we know exactly what a person suffering from mental illness is going through. We must recognize we're limited because ultimately we are not the ones experiencing these issues. Similarly, people who have not lived with or cared for someone with a mental illness often have difficulties understanding what family members and other caregivers go through. These individuals have an up-close look that fully involves them, yet they still feel like outsiders, frustrated by trying to provide care without knowing precisely what the mental health sufferer is experiencing or feeling. And these caregivers often feel desperation, not knowing the best way to help, and ask themselves things like, should I insist he see a counselor, or will that make him angry? Should I mention that he seems to be having a difficult time holding down a job, or will this hurt his self-esteem? Should I ask him straight out if he is suicidal, or will that give him the idea? And they worry and pray, then worry some more. And as a former member of this group, I can tell you it is grueling. And I thought this time I would start with that because I think that for those of us who are trying to help someone, sometimes that's exactly how they feel. And since this book is part of suicide prevention, she said, should I ask about that? And of course, we're learning more and more about that we should definitely ask, are you thinking of, killing yourself, as a direct question. So, as I read the book, I felt so bad for Nick. And I also felt so bad for his family because it seemed like they had no way of really understanding how to help Nick, and Nick really didn't reach out. So I was wondering, what did those of you who have read the book, what did you think? Is it hard for, I mean, it's hard for people to ask help, and I don't think Nick really knew what help he needed. I mean, he went to 2 counselors, and the one counselor, you know, that he stuck with, he then said, somehow was doing something inappropriate, and so they stopped going. But how, you know, is it difficult? I mean, many of you work in the field. What do you do if you're a parent and you don't know?
I think that's always the kind of that I really related to that balance of like push or help, back off or dig in. So I think that's always can be kind of a tough balance, but I certainly find that just asking more questions can sometimes help that person find what it is that they feel that they need, rather than telling them what they need. So when I picture the situation, if anyone here might be experiencing that, it's really to continue to ask questions about how they are feeling. What do they think that they need? What do they recognize as something that they want to get better? And the more that we can continue to show curiosity rather than coming and acting as though we know what's going on or what's best for them, but more showing curiosity and support, it might help motivate that person into a position where they might recognize, oh, maybe I do need help, or oh, maybe this could be something that you know could benefit me or help me get to the point where I want to get to. So I tend to go on to that side of just continuing to ask questions and help guide them for what they feel like they've recognized in themselves and where they think that they could go.
Okay, thank you.
Mhm.
I was just going to add that I feel like though it just depends on how close you are to the situation.
Right.
I know that in my personal situation with a very, very close loved one, just asking the question, are you having thoughts of suicide? For me, in that moment, it was very scary because I wanted to know the answer, but yet I was very afraid to know the answer. So it was that balance of what, and I know I need to ask the question because I'm in that field, you know, but like when you are that close to it, it makes it very difficult. You know, it's definitely easier for like somebody that that's not our direct loved one to ask those things. Yeah.
Yeah,
What about-
Michael,
Oh, go ahead, Tron.
I was going to say, I think Michael makes a great point too. And I felt like that the mom was a little bit stuck in that scenario of how much do I ask? How much am I being pushy? How much is, you know, how much is too much? It's a balancing act when you're trying to help somebody and help them without like pushing them away, right? So you know, like Rachel was saying, you definitely always want to ask questions, you always want to be proactive, but then like not be too pushy.
Right. It's interesting because I have a friend, and her daughter, like she'll ask questions and her daughter will just go to her room and shut the door. You know, I don't want to talk to you. And she said, you know, what do you do in a case where you just try to keep talking and try to open the door and you feel like literally, you know, it's being slammed shut in your face and you don't know how to help. And then, you know, she thinks her daughter's pretty much okay, but she's concerned enough that she's just not sure. So what is your recommendation in a situation like that, where you ask the questions, but there's no conversation? She goes to her room, she slams the door shut.
Yeah, again, I don't know. I don't know that there is any easy answers for that, Claudia. I think as long as you are still trying, as if you know, try to reach out for help. that might be a situation where, is there another family member that this person will respond to? Is there a friend that this person will respond to, depending on, you know, the situation? I think especially if you're dealing with a kid, dealing with a teenager, is there a friend that person will respond to? Friends are normally a good bet because there's not many teenagers that are going to slam their doors on friends.
Well, thanks for that. I'll let
Mhm.
her know.
Mhm.
You know, but that's sometimes what parents are dealing with, and they just feel at a loss. So that's great advice. In the book, she provides the definition, the DSM definition of mental health. And so I want to talk, I want to ask everyone here, what does mental health mean to you personally? And how do you maintain mental health?
Can I just say something about that earlier question that you had?
Oh,
Like,
sure.
I love that whole part that you read. The first thing I thought of was, wow, there are some people in the world that don't have anxiety or depression. Like that just kind of, I don't know, I've dealt with it my whole life. So that just kind of blew my mind to even think about that somebody wasn't dealing with that on a daily basis. But I think the way that I deal with mental health is to constantly keep talking to my husband, have that communication open. I have a 6-year-old and we talk as much as possible about real life things as we can, for a 6-year-old. I don't know when her son committed or took his own life, but I think it would be just so hard to talk to your kids about that. But anyways, I see a therapist. I continually talk with my family doctor, talk with my friends, and I have a church that I go to. So, and I also take medicine. So it's been a good balance so far. So I'm thankful for all of those things.
Yeah. Are there things that you enjoy doing that really help you with your anxiety, like, taking walks? I know going to church and being with friends. Is there anything else that you do that helps you feel helps also to balance you?
I like to travel. So just getting out of like my comfort zone and meeting new people, and I have social anxiety, but I love people very much. So kind of meeting new people and learning new cultures and that kind of thing helps me.
That's wonderful. Thank you for sharing.
Mhm.
What are the trends, since we have a lot of people here who are working in the field, let me ask you, what are the trends among youth that you are seeing when it comes to attempting suicide? For example, Nick had a questionable Asperger's syndrome, autism diagnosis, because now it's considered autism spectrum, and was bullied. What are you seeing among the youth that you are counseling?
There's certainly an increase of acuity of attempts of depression, of anxiety, certainly since the beginning of COVID. More isolation, more dependence on social media to connect to others. And I think I brought this up last discussion, but also just the LGBTQ community and the ways that they have been affected by policies and speech, and there's certainly a need for support there. So we've seen an increase in mental health concerns just because of the environment and stress that that community has been enduring. But on the other side of that, we've also seen an increase in mental health support through telehealth, through apps that can provide some support and use of coping skills or connecting to a therapist. There's an increase in being able to find ways to connect with teens through 741-741, which is that text line. So it's text to talk. So it's not someone having to call crisis anymore. It's an opportunity to be able to text connect with a counselor, which might meet the comfort level of most teens these days. So really, you know, as those needs evolve, so hopefully so is the support and technology.
Right, right. And you mentioned the LGBTQ. In fact, it on page 32, it said, you know, Nick had questioned his sexual orientation, who he was attracted to, and struggled with whether he was gay, straight, or asexual, experiencing little or no sexual attraction to others and or lack of interest in sexual relationships or behavior. And this was a personal internal struggle that he shared with me. And so it's, you know, exactly what you were saying, the LGBTQI community, you know, we're seeing a lot of that as well.
Absolutely.
So,
Sorry,
ahead.
Claudia. I was just
No,
going to
go.
say, I'm listening. You know, the thing I felt like Nick focused on the most was all of those things that you've mentioned. And I think there were a couple of more. He was bullied. But his main focus seemed to be he never fit in. And, you know, as a parent, when that's what you're hearing, you may not necessarily connect that to a mental health issue. I don't know what anybody else thinks about that has either experienced that as a clinician or, you know, just reading the book. That stood out to me as being a difficult thing to tease apart, right?
Well, and we also discussed this the last time, you know, the importance of especially children and the youth who feel that they don't fit in, and how that continued to increase as Nick aged. So in elementary school, there were issues. Then in middle school, it just escalated. In high school, it escalated. And then in college, of course, you know, it also happened where, you know, the kids thought he was strange. They kept putting him off to make him a roommate. So he was experiencing that isolation more and more. You know, a lot of school districts now have, and I think Trond, you talked about schools, what they're doing to make sure that children aren't isolated, you know, within the schools. But a lot of schools are starting programs like partnerships where they make sure children aren't eating lunch alone, that they have mentors who are maybe older, who are kind of like kindness mentors who come and take them along. And really what was interesting is in the book, Nick provided that for the freshmen that were coming into the high school. You know, after at his funeral, people were coming up and saying, you know, when I was a freshman in school and I was really scared, Nick was kind to me and kind of helped assimilate me into the high school scene. You know, you realize that those kinds of things are really, really, really important. And, you know, when I drive to work now, I really watch young people walking to school. And when I see them walking alone, I almost feel like I want to get out of the car and say, hey, let's walk together and smile or something. You know, because I think it's so important to have friends and a community. So thanks for bringing that up, Kim. And Trond, do you want to talk a little bit about what the school district is doing?
As far as like what my kids, where my kids go to with the yeah, so I think was I talking about them learning about the feelings and okay, yeah. So my kids are in Adams County. We're in Adams County. They go to Bermudian Springs School District, and that's where I went growing up. And my wife and I were a little bit hesitant to have them to have them go there, but it's turned out to be a great thing. And I was saying the last time they do a program for social and emotional learning. And a lot of it is about just expressing their feelings. It's about, they have this program called SOAR, which stands for, let me see, because my daughter got the award the 1 month. It's like something about owning your actions, accepting responsibility, and then it's stating your feelings, owning your actions, accepting responsibility. So the whole SOAR acronym stands for kind of just realizing what you're doing, whether it's positive or negative, accepting your responsibility, and then kind of passing it along. And I think that's a great thing, because we were talking the last time, how many kids don't necessarily know how to express feelings or know how to, talk to others. How many kids do not know, okay, well, if this is the feeling I'm having, I don't know what this is about. And so it's a good way just to help kids with their social and emotional development. And I think as well, for my kids, now my one's graduated, the other one is a junior, and my daughter just went to middle school, and I couldn't remember if they have the program in middle school or not. I'll have to ask her. But I know for elementary school, it was great, because the teachers, it's the idea of let's catch the kids doing good, right? So the kids are always being told, no, that's bad, it's bad, it's bad. And, go talk to the principal or whatever. But this is a way like you catch kids doing good. As a matter of fact, I know they have it in the middle school, because my daughter got one for listening well in music class or something. And they just pass out this little SOAR slip. And then like your name goes in, and you can get all these prizes and stuff. But it's awesome. I just think I thought it was an awesome thing that the school is doing.
And I think a lot of schools, I'm glad to hear that. A lot of schools are shifting towards that. Whenever they would identify how to support a child, whether it was emotional support or academic support, it was more wait until they fail and then catch them and pull them out of the regular classroom and put them in the special education classroom. And the way that they've shifted that is by instituting these positive behavior support systems where they recognize everyone doing well. And then if anyone's kind of having a tough time, then they go up into a tier 2 where maybe they have some social groups. And again, they're not being pulled from the regular academic program, but they're getting that extra support that they need. And then again, if they need some more support than that, then they can have something that's more individualized. So really, even if you don't have any kind of behavioral concerns in a school, you're still able to learn those social emotional pieces that Sean's talking about. That what are my feelings? How do I respond? And it's providing a common language across the children to be able to learn from the teachers. All the teachers are using the same language of, expressing themselves, identifying feelings. So it's a really cool system to be able to make sure that everyone's caught and in learning that, and learning those skills and being able to understand those skills. And then that builds compassion and community across the classrooms where bullying is less likely because there's a known expectation across all the kiddos that the teacher is able to reinforce. So it's really neat to see, like what Tron's talking about with the tickets. Like our school district does CHAMP tickets instead of SOAR, but it's an acronym, and it goes through all the different behaviors that's expected of them in the school. And kids will come home and say, I earned a CHAMP ticket today, and I put it in a raffle, and I get to go to the treasure box on Friday. So it's some pretty cool ways that we can try to support children that might be feeling excluded, like Nick was.
And really, from what you're both saying, it's also another way to really teach kindness. And one of the things that she says, in the book at the end is the importance of being kind to everyone. Yeah. And I tell everyone there's a fine line, which we all can cross in mental health at any time. And so, just by being kind can create such a change. We had a patient here who came in, who tried to die by suicide, and they have to be watched. So they have someone in the room with them. as a one-on-one, and oftentimes they don't talk. And there was one person who was a patient sitter who just started talking to them about food and what food they liked. And it was enough to show how much they cared that it turned this young lady around. And she wrote this exquisite letter saying that just that connection from that one person in that evening was enough to make her feel like it was okay for her to go on. I mean, it was beautiful. And I think that is the key, is how do we as a community, and as, you know, working in mental health, working in the health system, or just being community members, how do we pass on that kindness to make that what is the norm, instead of all the anger that we see, and the, you know, how do we do that?
So that's a great point, Claudia. And I guess if nothing else, I mean, we just try by example, you know, like you just try by example to be that kind person. There's a situation at the end of the book, I think, where his sister kind of, I don't know if she saved that guy's life by kind of talking to him on the elevator. But she really made an impact on him. I think that was the guy that then, like, did he give her flowers or something? Like, he sent flowers to her desk?
Yeah, she saw, well, she was riding up in the elevator with him, and she said, "Are you okay?" And he started to cry, and he said, "I don't know if I can take it anymore." And then he went out to, I guess, his office, because it was over lunch. And so she wrote him a note where she explained that her brother had died by suicide, and that, and just wrote a kind note that you matter, and gave it to him with a pack of Skittles, I think.
Yes.
And he said that completely made his day, and changed everything. And then you're right, he gave her flowers. Yeah, I love that. I mean, it just takes one little act of kindness like that, and we can change, because we don't know what kind of day that person, you know, is having. It really, after reading that, Trond, when you were talking, after that, I've started like buying people cups of coffee, just saying, "I bought your cup of coffee," like just trying to do things to make their days better, because I think it's just so important.
And I love the randomness of that, because it completely distracts from what someone expects for their day. You know what I mean? Like there's interactions that they can expect to have happen, and they know that certain people are there to rely on. But whenever you're able to introduce something that's like a surprise and is a complete choice without any like strings attached, I mean, that really shows some genuine, authentic.
Yeah, and I think we all need that. Like, it can completely change your day.
Yeah.
You know, and then, you know, it makes me think, because on page 86, you know, they said more children are killing themselves than ever before. It is the second leading cause of death in people between the ages of 10 and 34. In Franklin and Fulton counties, it used to be that the average death by suicide was, the average age was people in their like 60s. And it's down now to the mid 30s. And there's a tremendous rise in people 12 to 22 who are dying by suicide. And what was interesting, and I think they were talking that it's also changing from guns to hanging, which was said in the last one. So, you know, as we look at this, what do you consider the increase in young people dying by suicide? A friend of mine, their daughter just started her freshman year at University of Montana, and I think 2 weeks ago they had 2 deaths by suicide of freshmen.
You know, as a health educator with a teenage son, yeah, I'm talking as both parent and health educator at the moment. Not sure how I'm going to pull that off. But you know, he had COVID, and once that passed through his system, he got very depressed. And so we had a lot of these conversations. And one of the things that struck me as a health educator when I was talking to him through all the options, which basically I said, you know, we could do nothing and see how it goes. We can go to a counselor, we can go to your pediatrician, we can look at medication, we can look at lifestyle changes. You're outside every single day, you're active every single day, you're eating fruits and vegetables every single day, you're taking vitamins, you know, and I walk through a whole bunch of stuff. And the interesting thing that struck me is he chose the lifestyle changes. That's what he wanted to work on first, and he did. But not that he would know, but all of the things that as a health educator, I talk about for preventing heart disease or stroke or obesity or high blood pressure or type 2 diabetes are typically a lot of the same things that help us build resilience for our mental health. And so it's just an interesting shift I hope we're making, that we're bringing those mental health conversations into the normal health conversations of things like high blood pressure and diabetes, and because a lot of the preventative measures are the same.
Well, what's interesting is that, and we talked about this, so recommended resources available to help parents and families and children in crisis. So we have the Question, Persuade, Refer, which I just found out they are doing at York Hospital. They're going to have 2 4-hour live classes, which Dave Emrine is setting up. We have mental health first aid. And then in an article that I read in the New York Times, it said that intensive treatment is really the best way to help people. And many of you work at Phil Haven, so you know that things like cognitive behavioral therapy, parent management training, collaborative assessment and management of suicidality, and then acceptance and commitment therapy. And for teenagers at acute risk, they talk about dialectical behavior therapy, which we're fortunate because Rachel does DBT, which is the key evidence-based treatment endorsed by the American Association of Pediatrics. What's difficult is that these types of treatments are often difficult to get to for patients unless you have the treatment available, and it's a long treatment. It requires individual sessions, group sessions. It requires parents to participate, and it can often cost up to $10,000 for the whole treatment cycle for DBT. But it is it has such great success because parents ask questions just like you did, Kim, where a daughter's like, I'm going through total anxiety. I have a test tomorrow and it's just, and she's like, okay, calm down. What can we do? We can give you some good food. We can get you a good night's sleep. And then let's go over your test questions together so that you reduce the anxiety by doing things that help calm the child down. What are you seeing? Like, what therapies are you using, and what do you see working for you in the treatment that you offer to young people?
Well, first I'll say that while I admire DBT very much, and I use DBT informed practices whenever I work, I am not a DBT therapist. But
I'm sorry.
No, you're okay. The peer support specialist that joined with us last time, she did point out that Phil Haven does have DBT, and we do as an outpatient. option and a partial hospitalization or intensive outpatient option, because it's very intensive. It includes the family members with that process, and it talks about kind of like a replacement of feeling sensations and replacing it with other sensations, and it is actually a form of CBT, which we also use CBT informed practices through intensive behavioral health services as well. And motivational interviewing and ACT are often also use the acceptance commitment. And that's really kind of where we go back to, we're asking questions, we're meeting them where they are, we're finding what's motivating to them or where they want to be able to improve and change, and then help them recognize what are the steps that they want to take to get there. So it's very much, it works very well for adolescents because there's a lot that's part of their choices and their insight, and you help just kind of guide that conversation. So that works really well. And then we do also do, we have applied behavioral analysis, which is less feelings and more behavioral. But it does give kids the social skills that they need to be able to build connections and communication, which is really important. And we work with kids, I mean, as young as 3, who could be nonverbal, and learning ways to communicate and ask for things, which definitely helps build resilience because you're building connection and your ability to then cope with whatever those triggers might be. So we have a variety of things that we use, certainly. Intensive behavioral health, because we really adapt what the treatment model is based on what the needs are from the child. But yes, DBT is a wonderful, wonderful therapy, and certainly see a lot of progress that's made whenever it's being able to be engaged in.
Oh, well, thank you.
Yeah.
Thank you.
Yeah.
And Michael and Bev, what do you do as far as like how do you help on the because you work with outpatient, I'm thinking more so than, or do you work with both?
No, we're really the behind the scenes people.
Okay.
And to support the clinicians to do what they do.
Okay.
Like we're the first point of contact when families are reaching out for services. We're that first person that they talk to be able to get into services. So we're hearing the issues that the parents going through with
Okay.
trying to help their child, the symptoms of the child, and then we set them up for an evaluation then, which then will determine which course of action is best medically necessary to help that child and that family. So yeah, we're not in the direct.
So you're
care
the
of
front
it.
door hearing the
Yeah.
stories.
Yes. Yeah.
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 Wow. Well, thank you for what you do. Yeah. So I need to get back to my questions. What can parents, aunts, uncles, and neighbors do to help our young population build resilience? What can we do as a community to help our young people build resilience?
It's interesting you asked that, because I did a how to build resilience in your children from option B, whenever there was the option B summer series through the York Library. And some of the biggest points that they made from that book, that's from Adam Grant, who's from Penn, and Sheryl Sandberg, talk through kind of Sheryl Sandberg had lost her husband, and so she had reached out to Adam Grant saying, what can I do to take care of my kids? I'm worried about my kids. They just lost their dad. What are some things that we can do? And it really highlights kind of the resiliency aspect of coping with stress and trauma. And a lot of that is showing a child that they have choices, that they have value, that they add value to the family, that they're important to the family, that they have skills that are valued, that they're able to have connections, and that they can depend on things to happen, that there's kind of a normal routine, that there are things that they can expect to rely on. There's consistency involved where they know that if something happens, XYZ is there. So having kind of those things set in place for your child can help them become more resilient whenever there is stress or trauma. And I think that was one of the things that Linda brought up in the book. Was at the end, she talks about not only are we overscheduling our kids, but we're also taking away their capacity to cope with change, because we're so many times, this, she talks about kind of this generation of parenting and how we want to remove the obstacles for the kids. We want it to be, least negative experiences as possible. And she said maybe that was helpful for Nick, maybe not. But certainly whenever she addressed parenting with Kelly, then she tried to give her more independence. She tried to give her more space to be able to make mistakes and know that that was okay and that she could survive through those things. And so I definitely kind of connected those two in my head whenever I was reading that part, thinking this goes also back to just kind of building resiliency and how we can do that for our children.
Yeah. Yeah. Thank you.
Mhm.
Anyone else?
Yeah, I was going to say to Rachel's point, I think those were great points. I couldn't have said it better myself. That kind of sheltering of kids really tends to backfire on us because they have to be able to make mistakes, but then they have to have somebody to go to, and not all parents are either open to listening to their kids, or, I mean, I'm currently working with a situation right now where it's what I call I heard this at a training. I can't take credit for this, but years ago I went to a training and this trainer said, "Oh, this parent's like a Jiffy Lube parent," and everybody was like, "What's that mean?" And the idea was they want to bring their kid in, have their kid serviced, and have their kid come out, and everything's all good. And that's exactly what is going on with this family. And this young person has attempted on at least one occasion in the last couple of months. And so there's not that open line of communication. It's almost like we're hearing from the mom and dad, where can I send this kid so that when they come back, they'll be okay. They'll be the child that they were a year ago, So I think it's educating parents as well, the best we can, that your child grows and changes. Just because they were this way at 5, 6, 7 doesn't mean that 10, 11, 12, 15, 16, it's growth. They change. I think some of the parents today think that their kids are going to be the same, and that, okay, well, they did good in elementary school, so middle school will be the same. No, middle school is a whole new set of challenge in finding your identity. And so it's a lot of education to the parents so that they kind of know what the kid is possibly going through.
Yeah. Wow. Thank you for that.
Mhm.
It's interesting. I've heard parents where the children were really great, in elementary school and middle school. And then in high school, they just say, "Oh, I let them do whatever because I don't have to worry about them." And, some of them come up with huge challenges that for the parents, because the parents kind of were so hands off. I said to someone, sometimes I think of high schoolers as giant toddlers, not in, not like you have, but they still need you as a parent. And sometimes I think in high school, they need us more because they're really, they need our help in helping them help guide them through the mistakes that are happening, and the good times, the bad times, that we're there as a safety net. And like you said, to allow them to Rachel, to allow them to fail, but also to know that they are unconditionally loved, and we can move on from that failure and go to the next thing. I think that's resilience, is knowing that sometimes you will fail, but we can pick ourselves up and move on.
There's safety in that, but there's
Yes.
growth in that. Yeah.
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 Yeah, I would say that my oldest needed us more in his high school years than what he needed us in elementary and 3/4 of middle school. I would say that a lot of the situations with him, the emotional, started about 8th grade.
Yeah.
Around in there, and then definitely all through high school, he needed us for sure. And I also wanted to follow up on what Rachel said that I thought was great, is like the way we treat kids, right? So there's too much of this you're the kid, you should listen. You're the kid, you should do this. There's not this ability for choices, and there's not this ability for independence. And, it's more of talking at them and not talking with them.
Mhm. Absolutely.
Yeah, do you think having all these technological devices where the parents know through the phone exactly where, I mean, some of us, well, when I grew up, of course, there was no cell phone. So we had to make sure we had a dime so that we could call our parents from the nearest phone booth if we got in trouble or something. But I was in an orientation where one of the employees actually had a phone, and she could see her son driving the car into the garage after school. And she's like, okay, now I know he's okay. Like, so do you think that in itself, I mean, that we're overwatching our children, not allowing them to have some of those freedoms that we did when we were young?
It can certainly enable that. It depends on how the parent uses that. But if a parent is having a hard time letting go and providing that independence, it can certainly enable the parent to be a little bit more protective of the child. And yeah, so I definitely feel like surveillance is higher than it was whenever I was younger. And when that occurs, how are we providing space for our children to make mistakes and figure it out and learn from those things? And there's certainly growth in those opportunities.
So are there any other sections of the book that anyone read that they felt was like really profound or that they would like to talk about?
I think as a parent, I really appreciated Linda's, to me, no holds barred, laid everything out on the table, everything she thought, everything she said, whether it looked good for her or not. As a parent, that was helpful, right? Because we all have those times when we do things with our kids and we think, oh gosh, was that the right thing or the wrong thing? And anymore it's so easy to judge on social media. But I just appreciated her forthrightness, again, even if it made her be viewed as a bad parent, she put it out there anyway. And I think that's when it comes to suicide prevention, you need, to me, that kind of transparency.
Well, I would say, Kim, that we need that even as parents. Do you know how many times like I had to go back to my kids and be like, and I still do, like, yeah, sorry. I think I overreacted. I think I did the wrong thing. Normally it's after, and we check each other. So I was gonna say, normally it's after my wife's like, I think you overreacted to that scenario. And I'll be like, yeah, I probably did, but that's a checks and balance that not just, and I think if you show that vulnerability to kids, then they realize, I think what Rachel was saying, look, everybody makes mistakes.
Absolutely. And it models that for them, right? Like I'm going to come in and I feel embarrassed. I feel, I feel really sad, or I'm disappointed in myself the way I reacted to you. And you're giving them the language and words of how to own something and how to apologize and be like, I'm going to try better, to do something better, the next time. And then your child has that example of, we mess up and there's still acceptance in messing up and we can forgive. Like I think Linda also talks about like forgiveness of each other as part of kindness. And she showed so many examples of that throughout the book too. Like no one's going to have the perfect words, to say. I just don't tell me that you're carrying my son in your stomach and we'll be okay. Which was like wild. but she used humor, but she also, I mean, she just really assumed positive intent and gave everyone that grace of like, I'm not going to get this right, but I can say this and know that it's coming from a good place.
Right, right. And you know, the grief that the whole family dealt with, and you know, people don't know what to say. I mean,
Mhm.
you know, your son is in my stomach is, you know, one thing, but you don't often know what to say. And it was interesting because the CHNA for York had their meeting and they had the results of the community health needs assessment on Tuesday. And Kim was there, and we were able to hear Dr. Leanna Wen talk about public health. And, you know, she talked about overdose, which often happens also can be tied into mental health. So overdose deaths, and that a woman came to her in Baltimore and said, you know, she hopes that there will be a time when overdoses or suicide or anything like that would be considered a casserole. What did she call it?
A casserole
disease. Yeah. And so Dr. Leanna Wen is like, a casserole disease. What does she mean by that? And what she meant, what the woman said, you know, when you have a child that dies from natural causes or a family member that dies from natural causes, that it's like a heart or disease or something like that, everybody comes and brings a casserole because they care, you know, they want to show their, you know, their support. But when someone dies by suicide or of an overdose, they don't come with casseroles because they just don't know what to say. And it's almost kind of like a taboo.
And
Go ahead.
I was going to say, like, the part of this book that really hit home with me was because, I mean, this summer I had 3 people that I know that have committed suicide. The first one, June 29th, my husband and I have this really good friend, their 18-year-old son killed himself. And like, when we found out about that, we were just paralyzed. We were like, first of all, we were traumatized ourselves because, and I was glad that she brought up about the boy that had the mental break that filmed him and his girlfriend having, or the audio of having sex, and he left, because that's this situation that happened with us and this friend and their 18-year-old son. He had a mental break and killed himself, and we were literally paralyzed for weeks because we just didn't know what to say. Like, do we go over to their house? Do we give them space? Do we take them a casserole? Do we not? Like what is the, and I feel like we just don't know what to do in situations like that. But the examples that she gave, that she had said, you know, the more people that came over during the time soon after it happened, helped me to process it, to talk it out, to make it more of a reality. And it was like, oh, I looked at my husband 3 days ago and said, I feel like we failed Bonnie and Stacy, and by our distance during this time. And it was like, wow, like that, I don't know, that was just a real growing point this book allowed me to have, and that through this process for me, you know. So,
and hopefully something that you know, you're experiencing that now, but still being able to have that like authentic conversation with Bonnie and Stacy of like, wow, it just hit me, you know, and I'm, you know, and being able to repair that.
Yeah.
I agree with you, Michael. I loved her honesty and just the way she talked about things. And, you know, it's the same thing. There's another book that I was reading where even parents who have children who are jailed, like they need our support just as much, but almost they become like they've been jailed themselves, and there's such extreme isolation in that. You know, we all have things, we probably all of us have close friends or have things happen in our own lives where, it's where, what has saved us really is our community
Mhm.
of people that are around us.
Yeah.
And so this book really demonstrates the importance of community for our children, for us, and how we have to
Mhm.
take action and be the change that we want to see.
Mhm.
Most definitely.
I think that's important. Yeah, so as we're almost hitting the top of the hour, so I want to be cognizant of time. I do appreciate everyone joining. I do want to talk and make sure that people are aware, and I know the Franklin and Fulton County Mental Health Association, they actually they actually have the course asynchronously. Let me get my notes here. So that you can question, persuade, refer. They also have mental health first aid. Kim, do you want to talk about those courses a little bit that we offer?
Yeah, and I want to point out too that QPR, or question, persuade, refer, and mental health first aid, because we're virtual tonight and many of you aren't in Franklin Fulton County where Claudia and I are, Phil Haven has QPR and mental health first aid across many of the well-span counties, Lebanon, Lancaster, and York, virtual and in person. And the mental health associations within those counties. Sometimes Franklin County government here, and I'm sure other county governments in other counties will offer mental health first aid and QPR. So I want to make sure that we know of as many resources as possible where all of these trainings are offered. Because, even if it's, you're giving the course to 3 people in a small agency, you're giving the course to 3 people. So I don't know, Claudia, if that helps or not.
Yeah, no, that's fine. There are courses all over the place that you can access, and in each of the individual counties. And does Phil Haven have a website or anything where they talk about things they offer?
They
Like
do.
that? They do? Okay.
Mhm.
Also on, there's a lot on the internet. Of course, she talks about the resources that she has at the NICS site. So if you get a chance, definitely visit it. She has some great resources there. I went to the NIH, and the NIH has like a little poster that I actually printed, which is 5 action steps for helping someone in emotional pain. Of course, one, are you thinking about killing yourself? And I think one of the things that, we talk about, that it's really important to ask directly, are you thinking about killing yourself? That will not, if they are thinking about it, or if they aren't thinking about it, that is not going to be the impetus for them to start thinking about it. We often think that that's the case, but it's not. Number 2, keep them safe, reduce access to lethal items or places. One of the discussions that we had last year for suicide prevention was children under fire, and we had John Woodrow Cox, who was the author, with us. And one of the most important things is, especially if in households with firearms, to make sure they're locked away where children never can access it and don't have the codes. So keeping them safe. Be there, listen carefully, and acknowledge their feelings. We all have feelings, and I think nothing's worse than when you're trying to express yourself and no one even tries to understand, or they shoo it off, or like, oh, don't be sad, be happy. It's not always easy. Help them connect. Call or text 988, which is the crisis suicide and crisis lifeline number, which is wonderful. And then stay connected, always follow up and stay in touch after a crisis. We are so fortunate to be human beings in in a world where we can be connected through text message, through telephones, through Zoom. But to tell you the truth, I don't think anything beats, you know, a warm hug of support. I'm a big hugger. That's the one thing I disliked most about COVID.
Yeah.
You know, it's so important. A hug can just, you know, make someone feel so much better. We need to support one another. I think that's the most important thing.
Yeah, well said, Claudia.
So thanks. Thanks. Well, everyone, I wish you a wonderful evening. Thank you so much, everyone, for spending, you know, an hour on a beautiful night. I heard it's cooler. I'm going to go home soon. But blessings to all of you. Stay connected. If you have any time, our library at Chambersburg Hospital is open to the community. We have a great diversity and inclusion reading material. We have all kinds of other things, and we'll support everybody in any way we can. We're here for the community. So have a wonderful evening. And again, thank you so much.
Thank
Thank
you.
you all.
Thank you.